My name's Carrie Siegel. I'm an abdominal radiologist at Washington University in St. Louis. And I have a subspecialty interest in GU imaging, but I do all aspects of abdominal imaging. So the question is, what questions might a referring physician or a medical oncologist want to ask or inquire about when picking an imaging center to ensure top quality for their patient? There's a couple things. One, optimally, the imaging center would be staffed by physicians who are all board certified by the American Board of Radiology. And that means that all the radiologists have jumped through multiple hoops, including a very large exam at the end of their third year of residency with 18 different subspecialties, with expertise that they passed in physics and radioisotope safety. And then they pass a second exam 3 months either after their fellowship or 15 months after they finish their residency, with additional sort of expertise, ensuring that they are qualified to practice radiology. That's number one. The other, ideally, one would pick a imaging center where the radiologists are not only board certified, but are trained in abdominal imaging, where they have special expertise in renal imaging and renal mass imaging. The other is that the medical center have a dedicated renal mass protocol for cortical renal masses and a dedicated protocol for MR urography, looking at collecting system masses. The other things one would look for is, does this particular imaging center have access to the referring to the patient's prior CT, MR, and ultrasound exams, either through a radiology network or through the cloud? I can't say how important it is when we're looking at different masses to have information over time. That is extremely helpful in determining medical management. I think it's really important to look at MRI centers that are ACR accredited. And how I think of ACR is the American College of Radiology. And how I think of ACR accreditation is if you're going to rent a house and the house has great reviews, the superhosts we're much more confident that the superhosts have jumped through multiple hoops in terms of cleanliness and amenities and access and safety for the people that are staying. It's just sort of an additional level of confidence. We can have excellent MRI centers that are not ACR accredited. So if a referring doctor is using one and is happy, and he or she happens to look up and it's not ACR accredited, that doesn't mean one should switch. There's lots of excellent ones, but the ACR accreditation just gives an additional level of confidence that they're doing multiple things. One, they do daily testing with Phantom to assure that the image quality meets certain standards. When they're not of certain standards, the American College of Radiology can even help in tweaking whatever might be going on with the magnet to improve the image quality. They also have multiple safety factors in place when you're ACR accredited. Those safety factors include restricted access zones, screening of patients for metallic devices. Some metallic devices that are inside patients are MR approved and some are MR conditional. And different people in the department have to look up each device and approve whether it's safe for the patient to go into the magnet. Contrast agent safety, crash cart safety, which is important in a MR scanner because you can't bring everything into the MR scanner. And then there's all different kinds of other areas of safety that are checked on a daily basis. The intercom to make sure if the patient's communicating with the technologist, that the technologist will hear them. So the ACR accreditation mainly includes quality of the images and MR safety for everybody involved, and really just gives an additional stamp of confidence that the center has met all those criteria. So those are sort of the things that I'm looking for. A board certified radiologist, optimally with experience in abdominal imaging, dedicated renal protocols for both renal mass and for MR urography, and then the ACR accreditation and all that entails.